Another beautiful day with your fertility specialist. I want to say thank you for joining this live session today. I can assure you that it is going to be mind blowing. I am your host, Nare Joy Sati, and with me here is an exceptional person, the fertility specialist himself, in the person of Dr. Kenneth Eguda. You're welcome, sir. It's always good to have you on set, sir. All right. So today we're going to shake a table, a very important table.
Which day will they shake?
Table, male infertility.
And I'm just in a male fertility.
It's actually a table that needs to be shaken,
What of the tables
actually.
that have been shaking before?
No, this one is a special table.
Okay, that's
Yes.
fine.
And then why I'm saying it's a special table to be shaken is because this has been a topic that people shy away from, especially here in this part of the world where we come from. Male infertility is something that men don't really want to accept. They feel it's always the woman's fault
Mhm.
that we can't have babies. It's widely believed the moment a couple can't achieve
Mhm.
children, the next thing is the woman is the problem. And then I've heard a common saying that says only weak men are infertile.
In that case, all of us will have been infertile now.
So you understand that is why I
Because
said
guys
it's
like us, I don't have muscles and I'm not strong.
so it's actually a very important table.
All right.
So with this misconception that we're having about women being the only cause of infertility, and then you will hear people say, I've had children before, I'm a man, I've fathered babies before, so how can I be infertile? And then the saying I just said where it says weak men are infertile. So it brings me to ask this question: what is male infertility?
Mhm. Interesting. I don't know how to define it. Yes, I don't know how to define it. But maybe I'll try to explain.
Mm,
When the reason for a couple,
mm,
male and female,
yeah.
being unable to get pregnant
Mm,
is traceable to
mm,
abnormalities
mm.
with the sperm or delivery of sperms,
Okay.
which comes from a man,
Mm.
then of course you're talking about male
Male infertility.
infertility.
Mm,
In that case, the female partner,
mm.
it's normal, of good age. The fallopian tubes are okay, they are
Okay.
patent, they are
So you're
functional.
still going back to the woman.
Yes, they are functional. She's ovulating and
Yeah.
she's of good age.
Mm,
Yeah, so if she's okay in all of these
yeah.
ramification and the problem with
Mm,
conception,
yeah.
it's sperms and its abnormality and the
Mm.
delivery of sperms, then we're talking of male
Male
infertility.
infertility.
The man
Okay.
is unable to make the woman pregnant. I guess that's the deal we want to shake.
Yeah,
Let's
actually.
begin to shake
So,
it.
what are the common causes of male infertility?
Oh wow.
Mm,
Now men contribute only one thing to
okay.
fertility. I mean to conception,
Mm,
and which is the sperms.
mm,
Now, the sperms have certain characteristics.
okay.
They're supposed to be of certain number,
Mm,
in quantity. They're supposed to have some certain normalcy, the
yeah.
way they look, the head, the neck, the body, and the tail. Just look like tiny tadpoles around everywhere,
Okay.
and then the movements
Mm,
also needs to be normal,
okay.
but anything that makes us have a deviation from the normalcy
Mm,
of the male sperms
mm,
would cause male infertility. So
mm,
in this case, there are a lot of things that could be responsible for that.
mm.
One common area is infection.
Oh,
Yes,
wow.
infection. Infection, for instance, infections like gonorrhea,
Mm, wow.
syphilis,
Okay.
mumps, orchitis, especially when it
Mm.
affects young boys,
Oh.
mumps, orchitis. Um, yeah, these infections usually would
Okay.
can affect the pipe towards that leads
Oh,
to delivery of the
wow.
sperms to external,
Okay.
and then they could cause a blockage of the pipe that leads sperms out of their stores,
Mm,
and then the man will be unable to ejaculate sperms.
wow.
It could cause a problem. The infection could cause problems with the sperm producing or developing cells,
Okay.
you know, and then you have no sperms at all,
Mm.
yeah. So infection could be very big issues. Then you could have trauma, trauma. A lot of times, guys could be involved in accident, for instance,
Okay.
maybe through sports or road traffic accident or even a fall, and where
Mm.
the testicles may be traumatized,
Oh wow.
and then the trauma to the testes may affect the sperm producing cells
Mm.
or the sperm storage
Oh.
sacs, or
Oh.
even the pipe that leads the sperm out of the stores.
Oh.
And then they could heal with adhesions, fibrosis. So there'll either be no development or production of sperms
Mm.
or ejaculation of sperms.
Okay.
Then you will have lifestyle,
Mm.
lifestyle. For those who are into rigorous exercises,
Mm.
sports, bodybuilding
Okay.
stuff, and they could do a lot of steroids.
Oh wow.
Yeah. So, and some of these steroids have a way of affecting sperm development, and they could cause infertility. Now, a very important aspect could be genetic.
Oh. Okay.
When you have some syndromes, Klinefelter syndrome. I don't know how to explain that. It's a
Okay.
syndrome that affects genetics of a male,
Oh.
and part of what it affects is ability to produce sperms. And then you may not have enough sperms or sperms at all to make a woman pregnant. Yeah, there are other genetic conditions, cystic fibrosis, for instance, and
Okay.
all of those things could affect sperm development.
Mm-hmm.
Yeah, and sometimes you see these abnormalities affecting even twins. You see identical twins, for instance, that are male, both are unable to produce sperms. And sometimes you see parents who have difficulty with sperms having kids with abnormalities with
Mm.
sperms.
Okay.
So these are genetic conditions affecting sperm development. Lifestyle, I mean, exposure to environmental hazards, chemicals, or some form of therapies, cancer
Mm.
treatment, for instance, chemotherapies, and all of that, radiotherapy. They could all affect sperms and cause infertility for men.
Mm.
Then metabolic conditions like diabetes.
Oh wow.
Yes, that wrecks sperms a lot.
Oh.
So that even if you have sperms with these conditions,
Mm.
the sperms may be, and the sugar is uncontrolled, the sperms may be uh, poor in quality or count,
Wow.
and ability to make woman pregnant
Mm.
may be poor. So you could have some structural abnormality, like when you have abnormal blood vessels on the testes,
Oh.
like varicocele, varicose veins.
Oh.
When you have varicose veins on the testes, for instance, yeah, they retain heat on the testes because the
Mm.
blood doesn't flow away easily from the testes. So it makes the testicles hotter than it should be.
Wow.
And then because, excuse me, the sperms are sensitive to temperature, so you could have a lot of denaturation, I mean abnormal alteration of the DNA in the head of the sperms,
Okay.
and that can cause infertility. So the causes are quite numerous, but it's just a few, just a few.
Okay. So I was expecting, being the scientific preacher that you are, I was waiting for you to mention the spiritual aspect of some of the causes of male
Oh, Jesus
infertility.
Christ.
I was actually waiting for you to get there and tell me, oh, wait,
Alright.
there are spiritual aspects to this too. That was on the lighter note. On the
My
lighter
God.
note, though. So,
Yeah, there are. There are. That's it. But we're just talking science here. So
yeah.
I guess when we go to the temples,
Oh, we'll talk
we'll
about
talk
that.
about that.
All right. So, is there any link between age and male infertility?
Yes, there are.
Okay.
A very big link.
Mm.
Before now, when we were kids growing up, we, or rather in our early days in the medical career, yeah, in medical profession, we brag
Mm.
on being males, and we can produce sperms till we're 90, 100, and so
Yeah, I've
forth and
heard
so
that
forth.
before. Yeah.
And then men actually pride themselves on that. The
Mm.
truth is that yes, men could produce sperms till advanced age,
Okay.
but science has grown beyond that level, because
Mm.
now we see that as men are aging,
Mm.
every parameter about the sperms deteriorates.
Wow.
The count deteriorates, the quality deteriorates, the integrity of the DNA in the head of the sperm
Wow.
deteriorates, and the chance to making a woman pregnant also gets lower, and the
Wow.
chances of having abnormal babies because of male abnormalities with sperms are higher. And then the
Okay.
chances of having autistic babies are higher with advanced age men,
Oh,
and
wow.
having kids with juvenile tendencies also higher with advanced age men. So age also affect sperms
Okay.
with men, and the younger age group have better sperm quality, and I would want to extrapolate, have
Mm.
tendency to have a better kids. I mean, kids of higher quality
Okay.
than advanced age guys.
Okay. Not in
And
all
this is true.
kids.
I'm not just joking.
Okay.
This is very true.
Okay. So then how does then their lifestyle,
Mm.
if we're talking about the young people
Oh
having
yeah.
better quality to the older
You know,
people?
now that may actually also be changing now.
Yeah.
Because you see, lifestyle for young people these days is actually very interesting.
Mhm.
These days, young guys are exposed to a whole lot of
A lot.
hazardous lifestyle.
Behaviors, yeah.
Today we're in a digital age.
Mm.
And a lot of people have a lot of gadgets around them.
Yeah.
And then the more you get exposed to all of these gadgets,
Mm.
call it telephones, laptops, iPads, what again, and some people have two phones.
Mm. Yeah,
Some even
it's
have
true.
three.
Mm-hmm.
And the common ways places to put the phones are in our pockets.
Pockets. Yeah.
And these phones are have a lot of waves,
Mm.
and these waves have been shown in several researches and scientific documentation or papers that affects the integrity of sperms.
Wow.
So, and then I guess the longer you are
Mm.
exposed to these waves,
Mm.
the more damage you have to your sperms. So at the end of the day, you could have a lot of young guys having a lot of abnormal sperms, as much as the old guys are also having
Mm.
an abnormal sperm. So you are actually not too free in any of the spectrum. With the
Okay.
advanced guys, advanced age guys, if you take away phones, age just does all its problems.
Mm.
The BP affects sperms. BP with abnormal medication affects sperms. Diabetes, these are all things common with advanced age group. Then with the younger age group, it's just drugs,
Mm.
cigarettes, alcohol, gadgets, and all of those.
Mm.
These affect the health of sperms and can affect the ease with which their female folks or female
Mm.
partners get pregnant,
Yeah.
and the rate of abortion can actually be high because of abnormalities with
With the
sperms.
sperms. Oh,
Yeah.
wow. Wow.
So I
That's.
actually worry so much
Mm.
about the future of the very little kids that we all
Mm.
have. Those
Yeah.
who are 3, 4, 5 years,
Mm-hmm.
who already are getting so much exposure
To
to phones.
gadgets. Yeah.
And parents these days actually, um, I don't know what word to use now. Pacify the phones are now pacifiers.
Actually,
They're
for
now
babies.
pacifiers. And then once a child cries, just hand him the phone with a cartoon
That's all.
program, to play around with, and kids
Mm.
are so addicted to it.
Yes.
And that some kids, maybe those that still suck breast, even prefer the phone
Yeah,
to
actually.
breast milk,
Yeah, you find
you
them
know
distracted by it most
just
times.
distract them,
Yes.
and then, and once you give it to them,
Mm.
the first place they bring it so close to, it's down here,
Yes. That's
close to the
very true.
pelvic, I mean to the perineal area. So
Wow.
so close to radiation.
Oh.
And then parents are not even very sensitive that these
Wow.
phones have child's mode.
Mm.
And so a lot of parents don't turn these phones to the child
Child
mode
mode.
before giving it to the kids. And so the
Mm.
kids are exposed to the same thing that adults are exposed to. And
Mm.
then you have a lot of primitive cells around the
Oh.
testicular cells, the Sertoli cells, and
Mm-hmm.
all those things. So they get damaged.
Mm.
So I worry about more
Mm.
the lifestyle of kids that we have now than
Mm.
even the lifestyle of those of us who are already adults,
Mm.
and then than the lifestyle of those who are already growing out of existence, the aging men,
Yeah.
so
Mm.
lifestyle generally, and I really worry about the kids.
Okay, so this is a wake up call to parents. Please regulate the usage of phones to our
Yeah.
babies, actually, or you activate the child mode to make it safer for them. So, looking at our environment,
Hmm.
especially Plateau State that we're in,
Oh
this is the
yeah.
farming season right now.
Uh-huh.
And then, so how do we relate some of these environmental hazards to infertility?
Yes, let's go down to the farming, for instance.
Mm,
I see a lot of people doing the agriculture business,
yeah,
use of insecticide, pesticides,
a lot
fertilizers,
of chemicals.
and then a lot of chemicals.
Yes.
And a good number of these chemicals are toxic to human cells.
Ah,
And then these farmers are not that educated to know that you should be off the farm when these chemicals are being applied.
that's true.
So they apply the chemicals on the farm, they stay on the farm, they live on the farm, they cook and everything on the farm. So at the
Yes.
end of the day, they are exposed to so much
Yeah.
chemicals,
Mm,
volatile organic compounds,
ah,
and endocrine destructive factors with all these chemicals. So these chemicals don't only damage the ability to produce healthy sperms,
okay.
it also causes other endocrine abnormalities.
Mm,
They could affect their thyroid glands,
okay.
affect their pancreas,
Mm,
and have problem with other endocrine diseases.
mm,
So chemicals does all of this.
okay.
I have seen people who just transport agro-allied chemicals, and their work is to transport it from the factory
Mm,
to the end users. And then a good number of some of them I saw had abnormalities
oh,
with their sperms, all ranges of abnormalities, all because of constant exposure and inhalation
mm,
of these chemicals.
okay.
The same thing you talk about smoking, vaping, and all of that.
Mm,
So these are environmental hazards. These are environmental hazards.
wow.
Yeah.
So,
And this particular region has
mm,
a lot of mines.
yes,
People do a lot of
a
mining
lot.
activities,
Mm,
and then some of these mines have a lot of radiations that they emit,
wow,
and you don't even know how much effect this radiation has on the human bodies.
that's
And
true.
sometimes this radiation they emit doesn't just affect the sperms, but
Mm,
can even affect the DNA itself
mm,
and can cause some level of damage to the DNA. Then, if you have damage to the DNA, then you start thinking of mutation. Start seeing all kinds of genetic abnormalities, cancer here that were never very
mm,
common. You know,
wow.
yeah. So they affect sperms.
Wow.
So that's the environment there.
Wow, that's a lot. That's really a lot. And then
Environment.
I've heard somewhere that infections, that urinary tract infections that have been left untreated can
Urinary
cause
tract
also,
infection.
yeah,
Oh dear.
yes,
It's not a direct link because
okay,
the urinary tract.
hmm,
Okay, urinary tract for men, if
yes,
left in yeah, urinary tract for men, if you have infection, it
it's been left untreated.
can cause adhesions or
Hmm.
strictures on the urethra.
Oh,
For the man,
hmm,
the urine and the
hmm,
sperms comes out of the same pipe.
oh,
There is a kind of connection that happens around the prostate, but
hmm,
then the urine comes out from the bladder, but towards the end they use the same pipe,
okay,
the urethra.
yeah,
The sperm comes out of the urethra, the urine comes out through the urethra. So
hmm,
if urinary tract infection causes strictures on the urethra, then it can of course
hmm,
affect the male fertility.
wow,
You understand? So yes, the relations are not direct,
hmm,
but somehow it could
it can
actually
actually
have
be
an
cause.
impact
Wow.
on male fertility.
Wow. So don't leave it untreated. Get it
Oh,
treated
it
so it
should be
doesn't
treated.
affect. Yeah,
Sure.
so it
Yeah.
doesn't
Yeah.
affect. So, with your experience in the field of fertility, I can
Yeah.
say you've experienced a lot. So, what are some of this? What are some of the processes you use? Some of the methods you use to diagnose that a man is infertile. What tests do you usually prescribe to know?
All right. Usually, when we evaluate a couple for fertility, we analyze the sperms,
Hmm.
and then the sperm tells you a whole lot about the fertility status of the man.
Okay.
So, amongst the tests is a sperm analysis. So, in the sperm analysis, you're able to see the count of the sperm, the volume of the sperm, the motility of the sperm, the morphology of the sperm, the pH of the
Hmm.
sperms, and other minor parameters
Hmm.
of the sperms. Okay, so All these parameters I mentioned have the range that is considered to be normal.
Normal. Okay.
So if someone falls below the normal ranges, then of course you know that this sperms is abnormal. But then in some other persons, like for instance, in our time now, what WHO considers to be normal sperms
Mm.
is a sperm that is about 15 million per mil.
Okay.
But before now, it
Mm.
was 161 million per mil, came down
Okay.
to 60 something million per mil, and now
Wow, we're
it
on
went down to
15.
20 million per mil, and
Wow.
now we are at 15 million per mil. What
Okay.
makes 15 million per mil normal now? Where there are scientific considerations and all of that. But why was 160
Mm.
normal previously? So the world is changing,
Mm.
lifestyle is changing. What is normal is no longer normal.
Mm.
We have the new normal. So
Mhm.
any sperms that falls below these normal parameters
Okay.
in count, motility, morphology, and all of that is considered abnormal.
Mm.
And then you now look at the level of count. Some don't even have the sperms at all in the ejaculate,
Mm.
in which case they are completely azoospermic, as we call it.
Wow.
And then we'll have to look out whether their body produces sperms, but they are trapped somewhere,
Mm.
or they don't even produce sperms at all. If they
Mm.
produce sperms and are trapped somewhere, you
Mm.
want to go get them out from where they are trapped. A process we call PISA, that's testicular sperm extraction,
Wow.
yeah, or epididymal extraction of sperms. So you can
Okay.
use those extracted sperms to make babies
Mm.
by the process of IVF.
Okay.
So that's the way we analyze the sperms. We also analyze them for the presence of infections. So
Mm.
whatever abnormality is seen is
Mm.
discussed with the couple, and there are their options of treatment,
Mm.
uh, either in correcting the sperms
Mm.
or in treating the couple to get pregnant is being adopted.
Oh,
So that is just what we do with the sperms.
okay. So just like the women, I've heard something about hormonal assay and analysis for women. Is it also applicable to men?
Oh, sure.
Okay.
If a man has no sperms, for instance,
Yes.
if a man has no sperms, you want to be sure whether the body produces sperms.
Okay.
So there are quite a number of tests you may want to embark on to
Mhm.
do the hormone profiling for the man.
Okay.
Now there are also ranges of normalcy in the parameter that should be gotten.
Oh.
If the man is out of range,
Hmm.
then of course it means he has quote unquote hormone imbalance.
Okay.
So now there are some ranges that shows that the testicles are
Hmm.
not functional.
Hmm.
Yes,
Okay.
and there are some ranges that shows that the brain, the part of the brain that controls sperm production,
Oh.
and take the appropriate action that the testicles are dead.
Oh.
In which
Wow.
case you start thinking of possibility of sperm donation,
Wow.
or yeah, sperm donation.
Wow.
So those are so men have hormone abnormalities too.
Okay.
Yeah, in as much as the women have.
So is a male infertility treatable?
Sure, treatable.
Okay.
Depending on the degree of abnormalities. For
Okay.
instance, the common forms of treatment to offer when sperms are abnormal.
Hmm.
One is intrauterine insemination. When you have
Okay.
a good count,
Hmm.
maybe just slightly below normal,
Hmm.
and some level of good motility, you could attempt intrauterine insemination if the woman
Hmm.
is ovulating and the fallopian tubes are okay and the uterine cavity or lining is in good order.
Hmm.
You could do intrauterine insemination.
Okay.
Aside this, the other modality of treatment is the IVF. And now
Oh.
there are some level of sperms that are good enough for IVF,
Mhm.
and then some level of sperms that are only good enough for advanced IVF, which is the ICSI, what
Okay.
women call ICSI, in
Okay.
which case you just select a single sperm that is judged to be normal by
Oh.
whatever parameters your judgment is based on,
Hmm.
and you inject single sperm into a single egg.
Oh.
While in IVF, you just mix the eggs and the sperms together in a dish, and you expect them to fertilize just the way they fertilize themselves in the uterine cavity or in the fallopian
Oh.
tube.
Okay.
So those are basically the kind of treatment options that are available. But of course, where there are no sperms at all,
Hmm.
When there are no sperms at all, then the option of sperm donation becomes very important.
Okay.
Or if the sperms that the man has is more likely to give birth to abnormal babies based on
Mm,
genetic abnormalities, and
mm,
sperm donation
okay.
can be advised.
Okay.
If the man produces sperms but the
Mm,
sperms cannot be ejaculated,
mm,
because maybe the vast difference
okay.
is tied up or
Mm,
cut off or blocked
all
by
right.
infection or strictures or accident,
Okay.
and he still produces sperms, you could do some procedures on the testicles,
Oh,
and to extract the sperms and use it to make the wife pregnant.
all right.
So these are ranges of treatment that can be offered when sperms are abnormal.
Okay. So if I get you correctly, there are surgical treatments
Yes.
to this male
Yeah, yeah, yeah,
infertility.
yeah.
Okay. So what are those some of these treatments we have?
Uh, what we call the testicular sperm extraction,
Okay.
percutaneous or epididymal sperm extraction.
Okay.
So these are just the two main kind of treatment.
All right.
Yeah, sometimes you could take a crunch of the testicles and
Okay.
culture sperms from them.
Oh.
And yeah, you when you do all of this, the ranges of sperms you may get may be sperms at different levels of maturity.
Mm.
And then the chances of giving rise to pregnancy may be lower than
Mm.
when you have matured sperms
Oh.
ejaculated from the right places.
Okay.
Yeah. So these are various ways of doing this kind of treatment.
All right. So I remember from when you were talking about the causes
Hmm.
of some of this of male infertility, you mentioned something about varicose veins, if I
Oh
remember.
yeah, I
Yes.
did.
So how does a person treat that if maybe after making the diagnosis of
Mm.
this person having varicose veins, what do we do?
How come you remember varicose veins of all things?
I was actually paying attention.
Varicose veins. Boy, yeah,
Mm.
and that's actually a very tricky aspect of reproductive medicine that
Oh,
is coming to life, recently,
okay.
because you see, men could have normal count of sperms
Okay.
and have varicose veins and still be giving birth to babies. It's all
Oh,
right. But when you're dealing with fertility or
oh.
infertility and you have varicose veins,
Mm.
it is advised that that should be treated. And the way to treat the varicose veins
Mm.
is usually what a procedure we call varicocelectomy. This is
Oh,
actually carried out by the urologist,
okay.
where varicose veins means abnormally
Mm.
dilated, tortuous, and multiple veins that encapsulate the
Oh,
testicles.
wow.
They just spread around the testicles like worms.
Oh,
The testicles are meant to be like 5 degrees lower in temperature
okay.
than the general body.
Okay.
You understand? So when you have these abnormal blood vessels there, they
Mm.
equate the temperature across,
Oh,
or even make it a little hotter than the regular body. And the sperms,
mm.
are sensitive to temperature because the DNA is proteins,
Mm.
so
Okay.
it could cause fragmentation of the sperms, the
Okay.
DNA in the head of the sperms,
Mm.
and then the tortuous varicose veins doesn't conduct heat out of that because it causes stasis of the
Oh,
blood flow,
okay.
and so it doesn't take out metabolites
Mm.
away, from the testicles.
No.
So the testes and the sperms are exposed to oxidative stress,
Mm.
and this damage the sperm. So the way to treat it is just take out the excess and abnormal blood vessels.
Is that a
It's
surgical
surgical
procedure?
procedure.
Oh,
Yes, it's surgical
okay.
procedure.
Oh,
Yeah,
wow.
you operate and just take out the abnormal excess
Oh,
tortuous
wow.
blood vessels.
So
And a
this,
good number of men
uh,
just go get pregnant spontaneously from that aspect,
without knowing that they have
without yeah,
that.
yeah, yeah, yeah,
Okay.
without needing IVF. But of
Okay.
course, if the sperms are already very poor, I
Mm.
mean they are low, then
Okay.
you're better off having it still removed,
Mm.
and then you have sperms that are not exposed to metabolites that are destructive.
Wow. Okay.
So it's advised
Hmm.
that if there are varicose veins and fertility treatment is being
Go through.
undertaken, you should
Yeah.
have a varicocelectomy.
Okay.
Yeah,
Hmm. So, like, I'm picking a lot from what you're saying right
I'm
now.
happy.
All right. So you're saying the sperm cells are sensitive to heat.
Yes, to
Okay,
heat.
so I've seen where men
Mm-hmm.
put on 3, 4 trousers
Mm-hmm.
like to move around in a day.
Why?
I don't know. I've seen construction workers actually. I've seen construction workers
You want to go
put.
tell them not to put on three trousers? Do you know what they are protecting?
I don't know. Maybe they think they're trying to protect the area. So it's obvious they're causing more damage to it without really realizing
Mhm.
what they're doing.
Yeah, that's true. That's a good observation you've made. But then you see, there are kinds of underpants
Okay.
that are advised. That people wear, especially those of cotton materials and all of that. When we're in medical schools, those days, we want to take history of people going through infertility. We'll ask them what kind of pants they wear.
That's serious.
Yeah, what kind of pants? Because
Hmm.
there are some of those wears that traps heat,
Hmm.
or stores heat.
Okay.
Those are discouraged.
Wow.
And so maybe you should go tell the construction workers to be wearing just one trousers or one short.
Some of them attribute it to the cold weather, and then you find them putting on a lot of clothing and all.
I think that's the
Hmm.
same. Maybe you talk about heat. That's the same thing that happened when guys have their laptops on their
Hmm.
thighs.
Hmm.
And laptops can be very hot.
Yes.
You
Yes.
know, especially if you're doing heavy jobs on your laptops.
Hmm.
You know, they can be very hot, and they
That's
can burn the testicles.
That's serious. So please keep your laptops away from your laps so you don't burn your testicles. FYI from Dr. Kenneth.
I know it can actually cause unnecessary heat, and those heat
Yes.
can actually affect the quality of the
Okay,
sperms.
so that means a lot of people have been doing damage without
Oh,
realizing
sure.
it. Yes.
Yeah, yeah.
So this is a forum for you to understand. That's why I said it's a table that you're really shaking, because
Hmm.
I'm sure a lot of people do not know
Mm.
that this is what they've been doing to their health, and then it comes later on in
Yeah,
life
yeah.
to bite hard on them. So, for people with low sperm count,
Mm.
for instance, is it possible they achieve success when they go for IVF?
You see, yeah, if you have low sperm count, the form of fertility treatment you should have is IVF, actually.
Okay.
But the poorer the quality of the sperms are, the
Okay.
lesser your chance of getting
Oh
pregnant, even
wow.
with IVF. And that's
Okay.
the misconception that the population may have been having, because some people come to the IVF consulting unit and feel that because it is IVF they are doing, and because that's their last resort, IVF must work. And then a lot of these IVFs fails because of abnormalities with sperms.
Mm,
So the fact that a sperms makes an egg fertilized
mm,
brings about division or cleavage of an embryos, and
okay.
even grows the embryos to blastocysts, doesn't necessarily mean everything is fine.
Mm,
A sperm that is very bad may also be having intrinsic abnormalities, especially with the genetic content.
mm,
And then you see
mm.
most of pregnancy that are failing are because of genetic abnormalities.
Oh,
And sperm is a huge contributor of gene abnormalities to pregnancy.
wow.
So when sperms are low, they
Mm,
could achieve pregnancy, but the chance is lower compared to sperms that are normal
mm,
and are of good count.
wow.
You understand? So it's good to know that,
Mm,
because I have had to talk to a lot of guys who feel that because they've come to do an IVF
mm,
with low sperms, and then the
okay.
IVF fails,
Mm,
something is wrong. Nobody sits down to analyze the genetics of a sperm outrightly.
oh,
So you really cannot tell
mm,
how much of a gene abnormality a sperm has, except you do a fertilization of an egg, for instance, and then you decide to do pre-implantation genetic diagnosis, which is a very cumbersome work to do, and then it's very expensive to undertake.
okay.
So when the sperms are low, it's actually a big challenge. You could just do fertilization,
Mm,
and then pregnancy may not happen. But
mm,
there's nothing else to do. That's the right way to go. You just take your chance until it
mm,
works
okay.
painfully.
Mm, wow.
Yeah. But of course, it works often too.
Okay.
Yeah.
So with the recent trend we're having about our terrible lifestyle,
Uh,
do you think checking like a seminal fluid analysis that you're talking about should be one of the routine checks men should do?
you know, I think I don't know. I really don't know if that should be a routine check that men should do, but I think it's not going to be out of place. Men will always do these things when there's a need for them to do such. You
Okay.
know, it's just like I'm in some places and women are asking, are quarreling that men make them go through a whole lot to the point of having to check their fallopian tubes before getting
So
married
men
to
should also
them.
do same.
You know that men should also check their sperms before getting married to women. Well, in that case, I say yes.
It's a fair
You
argument,
understand? It's a fair
actually.
argument. I
Yes.
agree to that, because men seems to be very reluctant to seek these fertility care in a lot of places, even when the problems is theirs. You understand? So I think it's not going to be out of place for a man who is concerned about the fertility of of his fam, of their own fertility to check and to know what exactly they're dealing with. So I think it's in order.
For them to have routine checks to
If
it.
they can, they should do it.
Since women are actually doing the same, so it's not
Because
out of
even
place.
sometimes I just wonder. I talk with my fertility team. You know, we screen a lot of sperms and see that a good number of the sperms are abnormal. And we just look at ourselves, surely those who are not yet married, say, our guy, don't you think you should check this thing?
That's true, actually.
Let's know whether we are going to advise you to freeze now. Because there are some abnormalities with sperms that are progressive. You check your sperms count now, and let's say the sperm count is 7 million,
Oh.
and then you're not married, and then you are not about giving birth to babies, then you'll be advised to freeze the sperms you have now.
Okay.
Yeah, go get somebody pregnant.
Really.
Yes, it's just about reproduction. Get someone pregnant,
Freeze
and
the
then
sperms,
your
actually.
sperms become useful. Otherwise, some of these these abnormalities with sperms
Okay.
can actually progress to the point to where you have no sperms, and then you've missed out of all opportunities to make someone pregnant, to freeze, or to father a child, to have a genetic connection, and all
Okay.
of that. Right now, in France,
Okay.
all the things I'm saying, I sometimes I laugh about them, but seriously, they are not just laughing matters.
Actually.
Now, in France, when you analyze your sperms, the sperms may get worse, and you may get to a point where you have no sperms anymore. And if you're getting older, urinary bladder is closely attached to the womb, to the uterus.
Okay.
So any movement or activities going on right there could have a transferred effect to the uterus.
Oh, wow.
And one common thing with this infection is that you could have fever,
Mm.
and the fever with elaboration of pyrogens in the human system can affect the process of implantation.
Wow.
And that's true. So urinary tract infection should be taken care of in the course of fertility treatment if a woman has signs for that. Just like we don't chase for every infection, we expect that a woman will tell us
Okay.
whether or not she has a urinary
Some of the
tract symptoms, and
Yes.
then we treat.
Okay.
I can't just go meet my client. Hey, do you have
Yeah,
urinary
it.
tract infection?
I can
Do
imagine
you
the
have
look on the
do you
client's
have a
face.
UTI? You have UTI and all of that.
No,
No,
you
but
don't.
it's expected that whatever feelings you have,
Mm.
you should be able to have a dialogue or a discussion with your caregiver, and then analyze accordingly.
Okay, so I've heard the statement that doctors are also counselors, right? You do a lot of counseling.
Yes,
Yes,
more
more
than a
than a
raving
raving
counselor.
counselor. So actually,
Yes, we
so
do.
do you think it's difficult with all your relations, all your discussions with them? Is it difficult for them to? Is it difficult for them to accept that they are actually infertile? This infertility is caused by them.
Men is very difficult. Men is very
So how do you
difficult.
handle that? So how do you handle that?
Sometimes I don't handle it. Sometimes I don't handle it. It's very difficult, It's very difficult, Well, in this case, I'll say it's good to be a
Oh
woman.
wow.
Yeah, it's good to
Oh
be a
wow.
woman.
Yeah,
Yeah,
it's good to
because
be a
I'm not
woman.
saying me being a woman. I'm not saying me being a woman now. That's not what I'm saying. Women accept this easily. When the problem is traceable to women, they accept it. But when it's traceable to man, the man go defensive. And that brings a whole lot of confusion, anarchy, and disharmony in the fertility treatment. I've seen situations where men refuse to accept
Wow.
the alternative to their problems
Wow.
in fertility treatment.
Wow.
And then the stories are very, very, very big stories. I saw a case, a woman knows she's without eggs. I mean, she has gone to that stage where she has no eggs, and then the man has no sperms too. She's willing to accept egg donation, and the man with no sperms is not willing to accept sperm donation.
Wow.
And then how does it end? And so men usually deny, you know, and are very reluctant to accepting alternative intervention when it gets to taking sperms.
Okay.
They want you to explore all options until they feel it is right to accept what options you are offering, especially when it has to do with sperm donation.
Oh wow.
So sperm donation is actually a good option,
Okay.
and it is done everywhere, as far as I'm concerned, in this world.
Okay. So I'm taking you back to some of the things you said again. All right. So you mentioned something about genes also playing a
Yeah.
part in some of the causes of male infertility. Can that be treated?
No, when it's genetic, now you're asking me a very tempting question. That every genetic condition can be treated,
Okay.
okay? But then this is the future of the medicine that we're doing. Genetic conditions can all be treated.
Okay.
The world may not be there right now,
Oh.
but we're certainly getting there. They can be treated using CRISPR or using any gene modification or gene editing medical technology.
Okay.
Okay, but with what we have right now, genetic conditions, I would say, are not treatable.
Okay, for
Yes,
now
for
they are not
now,
treatable.
yes,
So, okay,
are
so
not
I have a
treatable.
very, very dicey question to ask right now. So, if you're to change one thing about the society's view about regarding male infertility, what would that be?
I don't know what you're looking for in this question.
Because I think a lot has been hammered on the woman. I've seen cases where maybe the man has fathered a child before, and then all of a sudden he can't have children anymore, and then he says, "No, I have a child." So it has to be the woman. Or you find them saying, "I'm a healthy man. I have sex." Some actually attribute fertility to sexual performance.
Oh, sure.
Yes. So if we're to it's actually nice. That's what I'm asking. You actually to change some of these misconceptions. What would that be?
Yeah, I would like to tell the male folk that the fact that you have normal sperms today doesn't mean your sperms are going to be normal tomorrow. You know, sperms are living. They're living uh, cells.
Okay.
They're living things. They have health, and they can be sick, just the way human beings get sick. So, but because things happen to them quietly without people knowing. Nobody thinks that this can just be abnormal. And because men have intercourse and they ejaculate whatever they think they ejaculate, they think all of those things are sperms. These are actually not sperms. So sperms have health and have qualities, and there's a certain way they look. So is an understanding of sperms I like to change.
Okay.
And then I like men to know that the fact that you're able to father a woman, I mean babies today, or you've
Mm.
fathered some babies previously, it doesn't mean that you
Mm.
still have the same capacity to father babies
Furthermore,
today.
okay.
So if they have that understanding,
Mm.
I think their minds or our
Mm.
minds would be open to
Yeah.
accepting
Mm.
differences
Mm.
from what observations we've made previously.
Mm. Yeah, that's true. All right. So we have another question from one of our followers on Facebook, God's Gift ABC. Thank you, Mrs. God's Gift. It says, can urinary tract infection, things almost similar with the other question we took,
Yeah.
affect woman's implantation after embryo transfer?
It can affect it.
Mm.
Yeah, it can affect. It depends on
Mm.
depends on
Mm. Mm.
how serious the seriousness of the UTI,
So I
but it
think
can
whatever it
definitely
is, you get
affect it.
treated before the
Yeah,
embryo transfer.
and even if it is discovered after embryo transfer,
Mm.
and it's very severe, there are some form
Mm.
of treatment that can be given that may be
Okay.
safe for the process you're undergoing.
All right,
Yeah.
all right. So thank you very much. Thank you for this enlightening session. It's been amazing. I think I enjoyed the session because it shook the table I wanted it to shake actually. Because a lot has been going on in the world, and then lots of people are just apportioning blames instead of actually doing the right thing, getting tested, getting treated, and we're just pushing blames here and there. So before we go, I would like to ask some of these investigations, the surgical interventions, the medical interventions you've mentioned, are they all available at ALPS hospitals?
Sure.
Okay.
Everything I mentioned here
So
available in
it's
house
available at
hospitals,
ALPS
and
hospital.
these are all the things I do. As a matter of
Okay,
fact, yeah.
okay. So if you want to get tested, you want to get checked, if you want to do it routinely, please rush down to Alps Hospital. There's also a number on the screen. Of course, you can call, you can reach out to them. There's a number attached to the page, whether on WhatsApp, TikTok, Instagram, Facebook, whatever it is. Reach out with your questions. I'm sure it will be addressed. I am very grateful to all our viewers today. I am sure you enjoyed the session like I did. It's always, and like I told you, it's always a flex having Dr. Kenneth on set. He's always making every conversation entertaining, and we're able to learn something that we know that we never expected. So thank you very much for liking. Thank you very much for commenting. Thank you very much for sticking with us to the end of this session today. So see you again next time. Thank you very much.